quality assurance and quality control practices in the laboratory. Here are your learning objectives. So the clinical lab has some regulatory and accrediting organizations that oversee what we do. The first one is CLIA, or the Clinical Laboratory Improvement Amendments of 1988, the Joint Commission, and then COLA, which is the Commission on Office Laboratory Accreditation, and CAP, which is the College of American Pathologists. So some non-analytical factors that are related to testing accuracy is having qualified personnel. So the laboratory testing must be conducted by personnel with proper certification for the specific test being performed. It helps to ensure accuracy, reliability, and compliance with those regulations. We also have to have laboratory policies. So laboratories should have established policies covering all aspects of operations. It includes safety protocols, quality control measures, and standard operating procedures. Some of those manuals that we must have are a laboratory reference manual, and that contains information on the test offered, methodologies, and reference ranges. A safety manual, which provides guidance for handling hazardous materials, infection control, and emergency procedures. And having a laboratory procedure manual, which is a step-by-step instruction for performing each laboratory test. For following a specific protocol, so all laboratory testing must adhere to established protocols to ensure consistency and accuracy. These protocols help prevent errors and help to ensure reproducibility of these results. For the test requisition, so before performing any test, a test requisition must be completed. Some items that have to be included on that test requisition is patient identification, so name, ID number, and/or medical record number or date of birth. We also need to have the time and date of collection, and this helps to ensure timely and accurate analysis. We need to know the source of the specimen, so the type of sample, is it blood, is it urine, is it a tissue? We also need to know the specific test that is going to be ordered or performed. So the importance of this is having correct and complete requisitions can help prevent misidentification of the paper or of the patient or the sample type, and it can prevent improper testing and reporting errors. Patient identification, specimen procurement, and labeling. So accurate patient identification is critical to avoid errors. We need to have two sources of identification that are going to be required, so name and their medical record number, name and date of birth, something along those lines. We have to have two different identification. So proper labeling of specimens helps to ensure traceability and prevents mix-ups. And specimen collection must follow correct procedures to maintain the integrity of the specimen. For preventative maintenance of the equipment, so laboratory equipment does require regular preventative maintenance, and this maintenance includes cleaning, calibration, and inspection. A schedule must be followed and maintenance records must be maintained. For proper equipment functioning, it's essential for reliable test results. For appropriate testing methods, so tests must be performed using validated and appropriate methods. Using correct methodology ensures accuracy, reliability, and compliance with standards. For procedure assessment and quality control, so all procedures should be regularly assessed to detect problems early, and continuous monitoring will help prevent inaccurate results. On how to handle errors, laboratory errors must be recorded and reported promptly. Attempts should be made to correct problems and prevent recurrence. Maintaining an error log supports quality improvement and helps with patient safety. Some causes of technical errors in serology, or really just in the lab in general. We have a false positive error that occurs when a test indicates a condition is present when it is actually not. Common causes could be the use of dirty glassware, so there could be some contaminant that may react with the reagents. Having maybe a hemolyzed patient serum, so the damaged red blood cells release substances that could potentially interfere with the test. We also have a false negative error, which occurs when a test fails to detect a condition that is actually present. So some of the common causes for this is omitting patient serum or reagent from the test mixture, which is basically just an incomplete test setup, or under centrifugation or vigorous shaking of the test. So that can lead to improper sample handling, which can then affect results. Errors that can cause either false positive or false negative results. So incorrect labeling of the test tubes, that can lead to misidentification and obviously reporting errors. erroneously reading or interpreting results, so human error. So some takeaways from this. So the most laboratory errors can be prevented with proper technique, careful labeling, and adherence to these protocols. Accurate testing requires vigilance in every step, from specimen handling, reagent use, and result interpretation. There are 3 different phases where laboratory errors could occur. So laboratory errors can occur at the pre-analytical, analytical, and post-analytical phase of testing. Pre-analytical errors are errors that occur before the actual testing of the specimen. So examples of this would be specimens being obtained from the wrong patient, incorrect labeling of the specimen, or improper specimen collection, handling, or even transport. For analytical errors, these are errors that occur during the testing process. So some examples of this would be incorrect quality control practices, so failure to follow protocols or calibrate reagents or instruments, using improper techniques or reagents, equipment malfunction, which is related to the maintenance issues. And then our last one is post-analytical errors. So these are errors that occur after testing is completed. So some examples of this would be recording results inaccurately in the patient record, verbally reporting results for the wrong patient, and or a misinterpretation of test outcomes. So just make sure you know that laboratory errors can happen at any stage of the testing process. Preventative measures include proper identification, strict adherence to those protocols, quality control, and careful result reporting. So quality in the laboratory. So there is importance, obviously, in documentation, just like everything else in the lab. So documentation is a critical aspect of quality assurance in the laboratory. Accurate records allow for traceability, compliance, and even error prevention. This can help support investigation of problems and continuous improvement. Some different types of documentation is we have preventative maintenance records. These keep track of equipment maintenance schedules, calibrations, and repairs. It helps to ensure that instruments function correctly and reliably. Then we have temperature charts. These monitor storage conditions for reagents, samples, and equipment, and it helps maintain sample integrity and accurate results. And then we also have our quality control charts for these specific assays, and these track performance of those individual tests over time, which can help identify trends, deviations, or errors in testing, and can also support corrective actions when QC limits are exceeded. All right, so some quality descriptors. We have quality control. The definition of that is these are procedures that are used to detect errors that are caused by test system failure, adverse environmental conditions like temperature or humidity, and differences between technologists, so human variability. The purpose of this is to ensure reliability and validity of these laboratory results. We can also use it to identify problems before reporting out patient results. Accuracy is how close a test result is to the true or accepted value. So the importance of this is the high accuracy ensures that patient results reflect actual clinical status. So just for an example, let's say we have a glucose test result that is very close to the patient's real blood glucose level. That would be considered accurate. And then we have precision. That is how close repeated test results are to each other when analyzing the same specimen multiple times. The importance of precision. So high precision indicates reproducibility and reliability of the testing process. So just an example of this would be running the same cholesterol sample 5 times and getting, basically the same result each time. That would be considered precision. Some takeaways from this. So we have quality control, maintains accuracy and precision, reducing errors and ensuring trustworthy laboratory results. Both accuracy and precision are essential for valid patient care decisions. For improvement of accuracy, we can use standardized procedures. So laboratory tests should be performed using established and those standardized protocols. This ensures consistency, reliability, and reproducibility across all tests and technologists. We have different comparison of these methods. So new methods must be statistically compared with established reference methods. This purpose is to verify that new techniques provide results consistent with accepted standards. This helps to ensure clinical accuracy before implementing new procedures in routine testing. So the use of controls. So laboratories use samples of known values, also called controls, to monitor test performance. Controls help detect systematic errors and validate that assays are functioning correctly. We also participate in proficiency testing programs. So proficiency testing involves external assessment of laboratory performance. So the laboratory will actually receive unknown samples from an outside vendor and analyze them to compare results with peer labs. This participation helps maintain compliance with regulatory standards, identify areas needing improvement, and demonstrates competency in testing for the testing personnel. Some test precision indicators that are used. So we have standard deviation. Definition of this is it is a measure of how much individual test results deviate from the mean of a set of repeated measurements. The purpose of the standard deviation is it helps quantify variability in test results and helps identify inconsistencies in assay performance. We also use the coefficient of variation, or the CV. Definition of this is it is a relative measure of variability expressed as a percentage of the mean. This allows comparison of variability across different tests or methods regardless of units or scale. The lower the CV indicates a higher precision, while higher CV indicates more variability. So some takeaways from this is we have the standard deviation, or the SD, provides absolute variability, while CV provides relative variability. Both are essential tools in quality control to help monitor precision and reliability of laboratory tests. For analytical sensitivity and specificity, so analytical sensitivity is the ability of a test to detect small amounts of a substance in a specimen. It determines how little of a substance can be measured accurately. The more sensitive tests can detect smaller concentrations of the analyte, and it is critical for detecting low-level infections or early disease markers. Analytical specificity, this is the ability of a test to measure only the intended substance without interference from similar or unrelated substances. So a highly specific test detects only the target analyte, and it helps reduce false positive results caused by cross-reactivity with other substances. It's important for ensuring correct diagnosis and avoiding misinterpretation. So just as kind of a summary, sensitivity ensures the test can detect small amounts, while specificity ensures the test measures only the substance of interest. Again, both of these are critical parameters for reliable and accurate laboratory testing. So clinical sensitivity, the definition, it is the proportion of patients with a specific disease or condition who give a positive test result. This measures the test's ability to correctly identify diseased patients, and a high clinical sensitivity reduces false negative results. So just as a quick example, let's say we have a test for a virus that detects 95 out of 100 infected patients, so that has a 95% clinical sensitivity. Whereas clinical specificity is the proportion of patients without the specific disease or condition who give a negative test result. This measures the test ability to correctly exclude healthy patients, and a high clinical specificity reduces false positive results. So an example of that would be a test that correctly identifies 97 out of 100 healthy patients as negative will have a 97% clinical specificity. So just as a summary, we have clinical sensitivity ensures the test detects disease when it's present, whereas clinical specificity ensures the test excludes disease when absent. Both of these parameters are essential for evaluating diagnostic test performance. For predictive values, we have positive predictive value. This is the proportion of patients with an abnormal or positive test result who actually have the disease. It indicates the likelihood that a positive test result correctly predicts the disease. So a high positive predictive value reduces false positive concerns. So for example, if we have 80 out of 100 patients with a positive test that truly have the disease, the positive predictive value is 80%. Then we have a negative predictive value, which is the proportion of patients with a normal or negative test result who truly do not have the disease. It indicates the likelihood that a negative test result correctly predicts absence of disease. A high negative predictive value reduces false negative concerns. So an example, if you have 95 out of 100 patients with a negative test that truly do not have the disease, the negative predictive value is 95%. So positive predictive value and negative predictive value are critical for interpreting the clinical usefulness of a diagnostic test. They will depend on both test performance, so sensitivity and specificity, and disease prevalence in the tested population. To monitor quality, we have proficiency testing in the laboratory. So the purpose of proficiency testing, it's a program that is designed to monitor quality control between laboratories. It helps to ensure that different laboratories produce consistent and accurate test results, and it also helps identify systemic errors or variations in testing procedures. For control specimens, these are provided for proficiency testing. They must be carried through the entire test procedure just like a patient. So we're not going to treat them, any different. They must be treated in exactly the same way as unknown samples or as patients, and they must be affected by all variables that can affect unknown specimens. So reagents, handling, environmental factors like storage and things like that. So proficiency testing will validate laboratory performance and ensure reliability and comparability of results across different labs. Proper handling of control specimens is critical for meaningful assessment. Some factors that can lead to out of control. So it could be due to deterioration of reagents or standards that can lead to inaccurate or unreliable results. Proper storage, handling, and expiration monitoring are essential. Then we have instrumentation and equipment. So faulty instruments or equipment can cause systematic errors. Preventative maintenance, calibration, and quality checks are critical for that. Glassware and labware can also cause issues. So dirty glassware can introduce contamination, which can cause false results. So we always need to make sure we clean and inspect glassware before using it. Timing and temperature. So lack of attention to incubation times or temperatures can affect chemical reactions and enzyme activity. So we have to make sure that we have strict adherence to protocol to make sure that it works appropriately. For testing methods, so use of unsuitable or unvalidated methods can actually produce incorrect results. So we need to make sure that we have a standardized and validated procedures that we have to follow. Human factors, so poor technique by the technologists, like pipetting errors, maybe improper mixing or mislabeling, can lead to errors as well. So training, competency assessments, and adherence to protocols will help minimize human error. Just as a quick summary, so laboratory errors arise from reagents, equipment, procedures, and human factors. Effective quality control, preventative maintenance, and standardization are essential to minimize these errors. All right, and then we have the normal distribution curve. So a normal distribution curve is a bell-shaped curve that represents the distribution of a set of values around a mean. So many biological and laboratory measurements will actually follow a normal distribution like hemoglobin or blood glucose levels. So some features of this is it has symmetry. So the curve is symmetric around the mean, which is the same as the median and the mode. It is a bell shape, so most values will cluster around the mean with fewer values at the top and bottom extremes. Standard deviation will determine the spread of the data. So approximately 68% of values fall within plus or minus 1 standard deviation of the mean, where 95% of values are going to fall within plus or minus 2 standard deviation of the mean, and 99.7% of values will fall within plus or minus 3 standard deviation of the mean. So the importance of this in laboratory testing is it helps in interpreting patient test results by comparing them to the reference or normal range. This is used in quality control, statistical analysis, and evaluating assay performance. It will help identify any outliers that may indicate errors or abnormal conditions. So the normal distribution curve is fundamental for understanding biological variability, establishing reference ranges, and evaluating laboratory data. Some basic statistical measures in lab that we use is the mean. That is the average of a set of numbers. So for calculation of that, it would be the sum of all the values divided by the number of values that you have. We use this in the lab to determine the central tendency of test results. For the median, the definition, it is the middle value in a set of numbers arranged in order. So it's used in the lab. It's useful when data has outliers, as it is less affected by extreme values than the mean. The mode, it is the value that occurs most frequently in a data set. So we use this to help identify common results in repeated measurements or populations. And then the standard deviation, it's a measure of the spread or dispersion of a set of values around the mean. It's used in the lab to assess variability in test results, and it is a component of quality control and reference range calculations. So the mean, median, and mode describe the central tendency of data, where the standard deviation describes the variability around the central tendency. Together, these statistics are essential for interpreting laboratory results, establishing reference ranges, and monitoring test quality. For the comparison of test results to reference populations, so the purpose of this comparison is we have laboratory test results are interpreted by comparing them to results from a representative population. This helps determine whether a patient's result is within normal limits or indicative of abnormality. For the reference population, this consists of individuals who are healthy, representative of the patient's age, sex, and other relevant factors. This data from this population is actually used to establish reference ranges for each laboratory test. So to interpret for the test results, so within reference range is when the patient result is going to be considered normal. If it is outside reference range, it may indicate disease, deficiency, or abnormal condition, or even prompt further testing. Statistical tools like mean, standard deviation, and normal distribution curves are used for comparison. So comparing individual test results to a representative population actually ensures meaningful clinical interpretation. Reference ranges provide the baseline for evaluating health status and detecting abnormalities. So validating new procedures. So the purpose of validating these, it is the essential part of our quality control or QC program. It helps to ensure that new methods produce reliable, accurate, and reproducible results before routine use. Reproducibility and confidence limits. So each lab must determine their own reproducibility or consistency of results for each procedure. Confidence limits are established to define acceptable variation in test results, and it helps to ensure that control specimens and patient samples yield consistent outcomes. Quality control program components, so we're going to have the calculation of the mean that will determine the central tendency of those control results. For standard deviation, it's going to measure the variability of repeated measurements. And then our control charts are a graphical representation of control results over time, which will actually detect trends or shifts in assay performance. It will help to identify potential errors early and ensure results remain within acceptable limits. So validation and ongoing QC are critical for maintaining accuracy, precision, and reliability of laboratory testing. Calculating mean, standard deviation, and maintaining control charts are actually a pretty fundamental QC practice that all laboratories take part in.